Behind the safety of sealed-off glasses of what used to be the management level for the Rita Flynn facility, Dr. Gary No, incident manager for the isolation facility, and his team are hard at work, currently overseeing 28 positive COVID patients. The mild cases and cases that don't show any symptoms are out in the open, while severe cases are put into these cubicles. Mosquito nets hanging over the beds are supplied by Rotary Malaria, as the isolation complex is next to the city drainage, exposing patients to mosquitoes. The last thing the medical team needs is mild and severe cases contracting malaria or dengue that may see their conditions worsen.
Quite a low land with the drainage and all that, so it's like a breeding ground for mosquitoes, so we do have problems with that. Hence, you see all the mosquito nets that were donated by Rotary against malaria. So it's just to protect the patients against them getting malaria or dengue.
In the middle, the nurses' station set up with a pull and drag system in place. Doctors and nurses working on the isolation floor, fully covered in level 3 PPE.
My fellow staff, I think they're okay, but I'm not good with sweat. I literally drape holes on a soak and come out after my shift. But thankfully this area is a laundry area plus shower, so we wash again and dry our clothes and back in again in the next hour.
Currently, there are 49 beds at the isolation floor, but with the capacity likely to increase to 70 beds if needed.
76 beds, at the most to 100 when the place is full capacity, and if we need to push it up. Our limitations at the moment, the ablution blocks. When we had the surge influx of patients, the ablution blocks, the toilets, we had problems with that due to the load, number of patients that were admitted.
But what's been the most untold story in the country so far is the fact that recovery rates have been so far successful. From Dr. Gary No and his team, 117 people have recovered from treatment received while in isolation. The treatment of COVID-19 patients, another huge debate for the medical fraternity in PNG.
We developed our own based off the Chinese treatment guideline, and then that got reviewed again by WHO, and then WHO put their stamp of approval on it. So any treatment and any drug treatment that we use here for the treatment of COVID patients is actually approved by a world body that has a panel of doctors that assess what's best for the patients. I will not submit patients here to medications and treatments that are unproven, because they are not guinea pigs. They are people of PNG. They deserve to be treated as per standards dictate. I won't allow for standards to come, treatment to come in unless they are sanctioned by our scientific committee at the national level and endorsed as such. Then I will adopt them. Aside from that, I will go with the best scientific knowledge available, and our treatment guidelines have been adopted, and we will provide that care here.
Dr. Wara Vagoli explains the current treatment process at Rita Flynn and why hydroxychloroquine is not used to treat patients.
Broken up into, depending on the case severity. So for mild cases, we give a different subset of management for that. Our moderate cases receive a different subset of management. And for our SARI cases or severe cases, moderate to severe, depending on the respiratory distress they're in, and to prevent them from getting onto the ventilator, dexamethasone has been shown to be of benefit, so we put them on a low dose of dexamethasone. And with the viral infection, when we clinically examine them and we think there's superimposed bacterial infections on board, other infections, then we put them on antibiotics, which is azithromycin is the drug of choice. We have these drugs available at Rita Flynn, so we give them to our patients. The same trial as well, the recovery trial showed that hydroxychloroquine was of no benefit in either prophylaxis or in treatment of patients with COVID-19. So based with our discussions with WHO, we tend to not use it at Rita Flynn.
Treatment is given based on individual cases and if they have any pre-existing conditions that are treated along with COVID-19. The doctors here dispelling the idea that the patients have the common flu.
Flus, they are self-limiting. Once you get them, they last for maybe less than a week or so. The body becomes immune to it, and then the symptoms resolve spontaneously. With COVID-19, we've seen that, it affects the body in such a way that the mucus produced is thick and sticky. And so most patients usually don't come with a runny nose or those sort of viral presentation. And then with that on top, they tend to develop other bacterial infections on board. And that's where the rationale for using antibiotics, like azithromycin and other antibiotics that we have. So that's sort of the difference with the common cold and then the COVID-19. Yeah.
While the lockdown in Port Moresby has come to an end, Dr. No only hopes residents will adhere to measures in place and practice healthy hygiene practices. As for frontline workers here at the isolation facility, they see the threat every day.
That lockdown also affects families. Lockdown will affect the income. Lockdown will make it people lose their jobs. People will do that. We've got to find that balance. And how do we find that balance? If you look at countries that are not implementing lockdown, the people are listening. People are wearing masks, they're distancing, they're washing hands, they have hand sanitizer around the place. So I think the onus falls back onto the general public. We've got to listen. We've got to adopt the new normal, and let's adopt the new normal and let's move on in our daily life with the new normal. Not only for COVID, like for TB, for other infections, it'll help. Stop the spread of all these infections that are going around the city and causing us problems.
Adelaide Sirox Kari, National EMTV News.